I'm Dr. Leibovitz, your Central Indiana go-to foot doc. In this video, we're going to talk about corn removers and why they can be dangerous. During this video, if you've learned something new, please hit the like button. If you want more videos that'll put you to sleep, hit the subscribe button. Now, if you've ever had a painful callus or corn lesion, you probably search for best corn removers to help yourself out. Well, corn removers might seem harmless and easy, but they can burn healthy skin and even send people to the hospital. In this video, we're going to explain why and who's at most risk. Most people know what a callus is. It's a thickened skin resulting from either pressure or friction. A corn is exactly the same thing, just a different name. Think of a corn or callus like a check engine light for your foot. It warns you that there's too much pressure, the skin will become painful and even fail. The thicker the skin lesion gets, the more painful it gets, is more of a warning sign. They can occur on the bottom of the foot, the bottom of the heel, top of the toes, or even between the toes. This is probably the most painful area that it can occur. Corns don't appear randomly. There's a reason for that. It happens to be a result of either foot deformity or the way the foot works. So how do corn removers work? Well, they contain a very strong acid that can burn the skin. The top layer may peel off and hopefully that will give you some relief, but the chemical is not very bright. It doesn't know good skin from bad skin. It doesn't know exactly how deep to go, and that's the problem. People that have diabetes, include poor circulation or numbness, skin disease such as scleroderma or weakened immune systems are very high at risk for problems, and that's healing. Even healthy adults can get painful burns, and this appears as kind of a white, soggy tissue. Now let's look at a safer and easier way to treat corns and calluses. The first step is to reduce pressure. For immediate relief, the callus can be reduced. If it's really thick, a podiatrist can safely and comfortably debride these down so they're in a much better condition. After it's treated, or if the callus or corn is very small, gently filing with a pumice stone or emery board 1 minute, 1 time a week should keep these comfortable and doing well. Other things you can do to offload the corn areas: reduce pressure. Shoe selection and modification will be helpful. Offloading inserts and silicone spacers can also be used. These protect the skin and provide comfort and slow down the return of the corn formation. Do not use blades, cheese grater type tools, or power rotary devices. They can cause serious injury. Unless you have malpractice insurance, stay away from these. Also avoid adhesive pads. They can irritate the skin and actually pull off the skin when removed. Use silicone or lamb's wool. If maintenance and reduction of pressure doesn't work, correction may be required. This means surgery, but that's a discussion to have at another time. Some conditions that look like corns and calluses are sealed sweat glands and plantar warts, and if these are occurring in a non-weight bearing area, have your physician check these out. Take home message: corn removers can burn the skin and cause some serious problems. Focus on the cause, the deformity, and the mechanics. Reduce pressure on the foot, not just look at the corn. The best corn remover? Well, there isn't one. Use safe methods, protect your feet, and consider seeing a podiatrist if needed. For more information about foot and ankle deformities and deformities that can create callus formation, go to my website at gotofootdoc.com.